Dear Dr. Nuzadio, I'm Ling Xin, and here is our policy brief. Brief report on China's home-based elderly care policy, adapting to aging with a people-centered approach. As of 2024, China has 310 million people aged 60 and above, which accounts for 22% of the total population. The traditional 4-to-1 family structure is under strain due to shrinking family sizes and urban migration. In response, the government has prioritized home based care as the strategic core of its elderly care system, promoting the 93/7 model. 90% of care is home based, 7% supported by communities, and only 3% provided in institutions. Since 1949, elderly care policy has evolved through three stages from the basic state led welfare model to market reforms and community care after 1978, and finally to a coordinated public private approach since 2012, with growing emphasis on smart and integrated services. Current policies aim to guarantee basics through fiscal subsidies for community service standards, expanding medical insurance, and the pilot programs for long term care insurance. Additional incentives include tax benefits and the integration of smart technologies into care services. Despite progress, challenges remain. These include fragmented policy implementation across regions, urban rural disparities in service provision, and a weak industrial base marked by underutilized private care facilities. Moving forward, priorities include improving cross departmental coordination, adapting policies to suit rural areas, and establishing stronger legal frameworks for sustainable and inclusive elderly care. With 310 million seniors and a rise in advanced aging and empty nest households, China faces a growing demand for flexible and localized elderly care. The limitation of traditional family based care, exacerbated by urbanization and the 4-to-1 structure, has made home based care more desirable. Over 90% of older adults express a preference for aging in place, aligning with the government's 93/7 model. The 14th five-year plan emphasizes home-based care as the cornerstone of a multi-tiered care system, aiming to ensure both quality of life and social stability. Today's approach embraces welfare pluralism, engaging enterprises, NGOs, and volunteers. A notable example is Beijing's model that combines care stations with neighborhood mutual aid, offering services like meal provision and companionship. Collaborative production is enhanced through the use of smart platforms and big data, allowing services to be better matched with seniors' needs, reducing inefficiencies, and improving care quality. This policy brief brings together these insights to propose evidence based strategies for building a resilient, inclusive, and people centered elderly care system in China.
Now, I briefly share our discussion on China's home-based elderly care policy. We focus on four key areas: how we approach the topic, what gap we found in current policies, the big issue behind these gaps, and identifying key stakeholders. In terms of methodology, we mainly rely on text analysis. This means that we look at policy documents and academic papers to understand the evolutions of China home-based elderly care policy. We try to understand what the government has been focusing on, how well these priorities will implement it in real life, and what aspects are still insufficient. This process helps us to identify areas where improvements may be made and what evidence supports these ideas. Next, let's talk about policy gaps. A big problem is that service providers are still limited. Most services come from the governments or communities organization, and they usually only provide basic daily care or simple activities. There is a still lack of medical support, mental health service, or personalized care that truly meets individual needs. Another problem is overall coverage. Some areas still lack complete facilities, and many communities lack barriers-free access or emergency call buttons, which obviously raises safety concerns. And the quality of caregiver is uneven. Not everyone is trained or certified, and many caregivers may not fully understand the various needs of the elderly. In addition, limited pay or training opportunity make it difficult to retain caregivers. These instabilities affects the consistency and reliability of care. In problem score, we found three main challenges. Firstly, there is a lack of coordination between policies and departments. Sometimes policies overlap or even contradict each other. For example, plans for the construction of elderly care facilities may not be consistent with local land use plans, which slow down the policy implementation process. Secondly, the gap between supply and demand is still large. There is a high demand for emotional support, social activities for the elderly, but existing services still focus on basic services. There are also big differences between urban and rural areas. Cities generally do better, while many rural areas still lack facilities, trained staff, and funds. Thirdly, fund is a big obstacle. New elderly care institutions require a lot of facilities, and local governments usually do not have enough funds to upgrade all facilities. Even for existing institutions, government subsidies are usually insufficient, which means that service providers may have to cut costs. The situation is equally serious in rural areas, where the elderly are usually unable to afford additional services and government support is limited. And in the implementation of home-based elderly care policies in China, we have identified four major stakeholders. Firstly, the governments play a leading role. Since the beginning of the 21st century, the Chinese government has introduced many policies to build a more complete elderly care system in response to the aging problem. The governments not only set policy direction, but also provide funding and supervisions, and guide local governments to adjust according to local needs. Then there are communities, which are basically frontline service providers. They organize service and work with governments and NGOs to provide support for the elderly. Communities help the elderly maintain social connections and protect their mental health. Enterprises are also increasingly involved, combining emerging technologies and business models to provide the elderly with more choices of care service products, improve care efficiency and personalization. Finally, there are families. They remain the cornerstone of China's elderly care service, providing important care and emotional support for the elderly.
Let me begin with the conclusion. China's home based elderly care policy lies at the heart of the country's aging strategy. With over 310 million citizens aged 60 and above, the need for reliable, accessible, and culturally acceptable care models is more urgent than ever. What makes this policy unique is its multi stakeholder approach. The government, communities, enterprises, social organizations, and families all play distinct but interconnected roles in supporting elderly care. However, challenges persist, especially in ensuring equitable access across urban and rural regions, aligning service supply with diverse elderly needs, and building a sustainable infrastructure of trained caregivers and service providers. Moving on to the implications. China's approach to elderly care is more than a domestic social policy. It is part of a broader commitment to sustainable development. Enhancing home based care not only improves the quality of life for seniors, but also supports long term goals, such as SDG 3, which emphasize health and well being, and SDG 4, which includes lifelong learning and capacity building. By improving policy coordination, upgrading infrastructure, and embracing smart technologies, the country can build a more inclusive and resilient care system, one that is better equipped to face the demographic realities of the future. Finally, let me touch on several recommendations for the way forward. First, stronger top level design and clearer coordination between government departments are essential. A unified legal and regulatory framework would help standardize service quality and clarify the roles of all stakeholders. Second, investment must be increased, especially to improve the physical infrastructure of home care, including the renovation of older urban and rural housings to make them more elderly friendly. Third, the integration of emerging technologies like big data and smart home systems can optimize service delivery by accurately matching elderly needs with available resources. Fourth, to build a strong support network, the government should offer fiscal incentives to encourage the participation of social organizations, enterprises, and community based groups. Fifth, we must improve human capital. Establishing a robust training and certification system for caregivers, along with better salaries and career incentives, will help build a qualified and motivated workforce. Lastly, by adopting a supply side reform mindset, we can reallocate resources more efficiently and ensure that elderly services are not only available but truly effective and equitable. In conclusion, the success of China's home based elderly care policy depends on strategic reforms, broader participation, and a shared vision for aging with dignity. If done right, it could become a model for sustainable aging care globally. Thank you for listening.